Artist has a better view. She has a mountain. How come I don't have a mountain?
Okay, we'll all rise for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay.
Welcome, everybody, to our first joint meeting of the year between the Arlington City Council, the Arlington School District, Public Health District number 3, known as Stille Valley Connections, and Public Health District number 1, the Skagit Regional Health. This is the first time due to the pandemic that we're meeting this year. So, and I'm sorry that we're not sharing a meal. I hope you all had a fun and safe Thanksgiving holiday. Jessica will let you call for the approval of the agenda.
Madam Mayor, I move to approve the agenda as presented.
Second.
All those in favor?
Aye.
Aye.
Opposed? All right, and Wendy's going to take the roll call for us.
Good evening. I have from the city of Arlington, Mike Hobson.
I think they can hear you. We're getting a lot of feedback and we can't hear.
Yeah, would
Somebody's
you mind
got the
please
game on.
muting yourselves until you're recording that you're here? Thank you.
Begin again.
Yeah.
Mike Hobson. Michelle Blythe.
Here.
Jen Schweddy.
Here.
Marilyn Ertley. Jessica Stickles.
Here.
Deborah Nelson.
Here.
John Manny.
Here.
Mayor Barb Tolbert.
Here.
Paul Ellis.
Here.
City Attorney Steve Piper. From Arlington Public Schools, I have Judy Fay,
Here.
Mike Ray,
Here.
Mark Rosen, Mary Levesque,
Here.
Sherry Kelly, Faith Graff,
Here.
Madeline Hendrich, Chris Sweeting,
Here.
Eric DeYoung,
Here.
Brian Lewis,
Here.
oh, Brian, are you there? Okay. Gary Sabol,
Here.
from Public Health District number 1, Skagit Regional Health, Julie Blazek,
I'm here.
Jeff Miller,
Here.
Gary Shand,
Here.
Bruce Lisser,
Present.
Daniel Reagan,
Here.
Brian Ivy,
Here.
Danny Vera,
Here.
Yola Barnett.
Here.
From Public Hospital District number 3, Stille Valley Health Connections, Tim Kavanaugh,
Here.
Tina Davis,
She's muted, but she's here.
She said here, unmute.
okay. Artist Smeegee,
Here.
Erica Cogno.
Here.
All right, that's a great attendance tonight. So first up, we're going to have Chris Sweeting give us the survey results from the work we did last year when we met in September.
I'm gonna, Paul, can I
Share
share?
your screen. Should be enabled.
Yeah, now it is. Okay, there we go. Thank you. So last year, it was November, December, we took a survey. All of us got online and we had a question to ask about what our projects should be together. And we actually identified through a long process that emergency management. And so the survey was to identify what actions or activities or goals we should take together. So this is the result. So we had 18 individuals respond. And it was responses were collected during November and December last year, 2019. The first question on the survey was, what do you believe is the goal of our joint work? The common thought among all the responses was that we would work together to collaborate and coordinate our actions, responses, and resources to address emergencies. And so then the next question, well, actually, before I go to the next question, I wanted to just read some of the comments that were listed, because what this was is an open-ended, people could write in. So this bullet says a response plan for different types of emergencies, earthquake and such, and make sure that we have all the specifics taken care of, communication, food, and logistics, and who's going to take the lead. Another individual said, have consistent and combined resources to emergencies. Another individual said, review and update the emergency management plan that was put in place a few years ago. Another comment, plan a coordinated emergency management system to make sure whenever possible, we are working in the same direction, sharing thoughts and resources. You can hear the common theme among these comments. Strengthen the existing emergency management plan. Work together and coordinate our actions to improve the health and safety of our community. Research, discuss, and define effective and efficient ways to inform students, parents, and community of emergency situations, along with the needed and necessary communication after the emergency, and then planning for the actions to be taken. These were all individuals, different individuals making these comments on the survey. I think the last bullet here, planning for actions to be taken in the event of a serious or widespread emergency event, took place. And part of in a moment after each agency shares their response to this emergency, which is COVID pandemic, we're going to talk about, what lessons have we learned and how can we together work through this event that actually has taken place and it's continuing to take place. So it was pretty much, we were unanimous in our thinking that we wanted to be coordinated and moving in the same direction and partnering and sharing our resources. The second question was, what activities or actions should we take? And some examples during the meeting were hire a consultant, either short-term or long-term, or form some subcommittees. So some of these were the common things. There were many, there's a lot of feedback on the activities, but I pulled together the themes that came out of all the comments. Number one, and they're kind of in the order of the way that the number of responses played out. But the first one is assign a primary lead for each agency or hire a consultant or short-term project manager. So think about these actions and these activities, because later they might play into some of the future activities we might want to do together. The next one is create a specific action plan that includes clear goals, responsibilities, and necessary investments or costs. And then the next bullet was form a committee or subcommittee. Some more activities that stood out: take inventory, set priorities, and evaluate response activities from each agency, which we're pretty much going to do tonight. We actually are going to think about those things and evaluate our responses that have taken place to the pandemic. Learn from others and what they are doing to respond to emergencies. This played into, there were comments that said, let's contact other cities, let's contact other school districts and see how they do this joint work together in emergency management. So that there was many comments that said we should look at that activity. and then maintain availability of our basic emergency supplies. So those were some of the common actions and activities. And the next question was, who needs to be involved? So this was just a variety of people. We need leads from each agency, or at least the survey said this. Of course, we need to have on board our emergency responders, fire, police, and hospital, and more. Principals, FEMA, Red Cross. Those were some of the people and agencies listed. Other comments or suggestions that came out of the survey: provide status reports, set goals and timelines, integrate our young people into our conversations. And I think that is critical. And what I would say, not just our young, but all of our generations should be involved in this conversation. And then create manuals or playbooks to help new staff get on board. And that is the end of the survey results. And so we're just gonna keep moving forward. I'm going to stop sharing right now. There you go.
Karen. Thank you. And so before we get into our breakout sessions this evening, we thought we'd get a quick update from all of the agencies, just a very short update on what their experiences has been during COVID and what they've done to mitigate some of the impacts. And I'll start with the city, and Paul Ellis will make that presentation.
Thank you, Mayor. I'll just go over some brief things that we learned when the COVID pandemic hit. Of course, we first think about the essential staff. The city operates more than just fire and police as essential staff. We also have streets, airport, and utilities. So if you think about it, outside of the traditional police and fire, those are also essential functions that we got to keep working. So we work to limit exposure of our staff, staggered work schedules, limited share equipment, and more frequent cleaning of common spaces, just basic items. Our IT department worked quickly to upgrade our technology to allow remote access. We had a lot of our administrative staff work from home, and we continue to do that. Our department directors created work packages that allowed that to happen. So staff has regular work that they can do remotely and check in with their supervisor regularly. City events, we had to cancel a lot of city events. In fact, we canceled almost all the city events for 2020 to stay in compliance with the governor's orders. This was really kind of one of those tragedies in the community. This occurred right at the beginning of when the community is used to their normal celebrations, fundraisers that the nonprofits do, and community events that our businesses, particularly downtown, rely on as part of their income. So that was really difficult. Communication, also a challenge. This was the first time that any of us have lived through a pandemic. So the information was coming out in real time. Our communication team had to focus their attention not only internally, but externally to keep people up to date on the things coming and going. And that was difficult. The city provided some financial relief where we could, using some CARES Act funding. So we had several rounds of business rental and mortgage relief for our local businesses to help them that were suffering from the COVID-related business challenges. We also had some grant opportunities for residents to help cover utility bill costs that were for people also affected by the COVID. We did some grants for nonprofits that were supporting services within our community. And we supplied the Family Resource Center with some funding to help residents that needed mortgage or rental relief. So that's kind of a quick overview of some of the things the city experienced during the pandemic so far.
Great. Let's hear from Chris Sweeting next on the school district.
So during this time, it's been very critical for us to be advocating for learning and safety during this pandemic. And it's been very challenging in that in-person learning is almost always better. And so it's been really hard because these two things we've had to consider on a daily basis because our job is educating students. So weighing the benefits versus the risks of in-person learning has been part of what we've been trying to learn, and lessons learned. We're still trying to learn even more how to do this, but we have to weigh every day what the benefits are in order to, we know that in-person learning is almost always better, and that providing better access to all students, but especially our youngest students and those students with significant needs and students that do not have connectivity, it would be better to be on campus in person. And it also would provide better support social emotionally and academically. But on the other hand, the risk is that being on campus and having more contact with people outside of our household creates better or more potential for transmission and increased infection and health challenges. And then on another part of the risk is having more students on site and staff on site can increase, because it's not when there would be infections, it's not if, it's when. And so we have had infections, but we've been containing them, but it's requiring contact tracing, it's requiring quarantine and isolation. So weighing those has been part of learning what we need to learn along the way. And this was the new, I had to show this tonight, had to show you that when we closed our facilities for on-campus learning, the rate was that first peak way back in March was at 129. But now today, the new numbers came out and they're 368. So those are the new numbers for today. So in the midst of this pandemic, we are advocating for learning to happen and safety to happen at the same time. And it's a challenge, but we're learning. One of the things that we do and the lessons that we've learned is that we cannot depend on one factor to help us make decisions. And so the lesson was that we had to look at multiple factors. And so this is something that we do every week, is we look at not only the county factors, so what's our risk level, what are the positive cases, and this county phase, we've kept track of it. We also look at the age of the students, 0 to 14, 15 to 19, look at the other ages, but in particular, we're looking at our students, the student ages. And then we look at the city infection rates. And then we look at us as a school district, what are our positive cases? And last week at the board meeting, you can see that we're doing a fairly good job of the protocols that we have in place to containing. Last Monday night, 0 positive cases. And at that time, last Monday, 27 close contacts or those that are being quarantined. So sorry about that, I think. So those are some of the factors, and we've learned a lot from that, and we've put some protocols in place. But one of the things that we've learned is that our approach is incredibly important in just maintaining calmness and hope. And so the first bullet here is keep hope alive. And at first we thought that in March, we thought, well, this was just a short-term crisis, but it's become long-term, and seeing, the end, it's stretching further and further out. But we know that there will be an end, and we know that we will have vaccines and those things. So keep hope alive, be transparent and communicate often, seek the wisdom of other experts. That was something incredibly important in this situation, and seeking the feedback and thoughts from all stakeholders. And we've learned a lot from listening to our stakeholders and being nimble, flexible, and assuming positive intent and being kinder than necessary. Other lessons learned, learning is happening at a distance. We are making it happen. We are, it's not perfect, but we are learning how to better engage students at a distance. And it is not easy, but we're getting better at it. And we're learning how to connect with students better. We have learned some lessons in creating or making available multiple options. And when I say that, we have made options available to our elementary families for them to, if they are not wanting to go into a hybrid mode, which is coming on campus when it's the right timing. Right now we have kindergarten and first grade students coming to campus 2 days a week. So they come 2 days on campus and then work at home for the other 3 days a week. But for those families that did not want that option, did not feel either that they just didn't want to go back and forth and have the uncertainty, or they didn't feel comfortable coming on campus, we opened up an option called continuous distance learning, where we have staff that they are assigned to and they are in that assignment the rest of the year. So that was, and we're still working on creating even more, or trying to expand that option. It's challenging, but we're working on exploring that. Zoom is working better than we could have imagined. It's, you know, and there's going to be some situations where we might continue some of our meetings on Zoom even after the pandemic. There are viable alternatives to many of the in-person functions that we've done in the past. So for example, we're using DocuSign for our IEPs, for signing contracts and board packets. And that's creates an efficiency there. So that's worked well. We've learned that we can actually do the things that we need to do and do it electronically. We have learned that we can remove barriers such as no connectivity. We can continue to advocate at the state level, at the local level for resources in that area, and we're doing that. We've learned lessons that connecting with others in our region and across our state is essential. And we've learned that it's far better to be together and know that we've got this and that we'll meet all the challenges together. So those are some of the lessons. And we've done similar to the city in that we have developed an agreement with our labor groups where we have gone through and identified specific areas that needed to be attended to for the workforce needs, such as leave. And if we have high risk individuals working from home, sometimes there's jobs that's not possible, but we have worked with our labor groups. We have reinvented ourselves pretty much. So lots of lessons. Thanks, Barb.
Thanks, Chris. I think we've all learned a lot of lessons during this. Next up, we're going to hear from the Cascade Valley Hospital or Skagit Regional Health, Yola Barnett.
Hi, thank you. So just like all of you, we've had several great lessons throughout the last few months. You know, it starts with being prepared. The health system has a formal emergency preparedness program. And one of the recommendations out of our committee a couple of years ago was to mandate that all of our leaders in the organization complete some FEMA training so that we would better understand incident command structure in the event of a true disaster. And so in 2019, all of our leaders actually completed that training, and that really benefited us to stand up a formal incident command set structure. And the structure of that and the cadence of that were such a way that provided a solid framework for the emergency operations. We ran all of our meetings virtually after the first couple of weeks in one big conference room. We found that we could do that via WebEx ideally and keep everyone safe. We were able to step down our incident command as our cases started to kind of go down in the summer. And we continued doing some background meetings, working on policies and procedures, and just making sure that we had that framework that would continue to support our workflows, especially as guidance from the Department of Health, OSHA, CDC, were constantly changing targets. With the fall, we've begun to see increasing patient visits and COVID admissions. We were able to stand our incident command back up to a full structure just recently, and we've begun planning again for surge. which we're currently now in full swing. We haven't had a surge beyond our actual capabilities at this point. I say that knock on wood. And we just continue to develop those workflows and set up resources to accommodate increases that we are seeing in patient volumes. One of the biggest challenges that we had in the beginning was on our supply chain. Acquiring supplies became a significant problem, particularly with masks and gloves and gowns and testing kits. While we never ran out of PPE, we had some uncomfortably low critical supplies at times, and our logistics team really worked hard together to set up a continual watch list of those critical supplies and just worked tirelessly to increase our days on hand. You know, when we first started this, we probably had somewhere in the neighborhood of 14 to 30 days of supplies on hand, and we've been able to increase that over the last few months up to over 40 days for many of our supplies. It does present a new challenge, which is, you know, the need for a large warehouse, but we're addressing that as time goes on. As the surge continues in other parts of the country, we continue to see our supply orders get rationed. You know, we order 1,000 widgets and we get 200, and we just try and order another 1,000 the following week and hope we get, you know, what we're ordering. Ongoing issues around obtaining N95 masks have presented challenges because within healthcare, we have to be formally fit tested to masks. And so the masks that we get aren't necessarily the masks that our staff were fit tested to. So it requires a lot of rework in fit testing people. Overall, I think that we've been very effective in keeping PPE on hand in our organization, which has really helped keep our staff safe from exposure. And we haven't had significant outbreaks within the organization at this point. Other areas, key lessons learned were data and information resources. We needed information from many different sources and to have that information refresh constantly, sometimes multiple times a day, so that we could assess our current situation. Comprehensive understanding of our burn rate on supplies really became a daily challenge. To address the need of increased resource consumption, our teams created dashboards that reflect our case trends in our respective counties, patient volumes, ICU bed availability, surge capacity, PPE, critical supplies, and several other indicators that we need to continually monitor. And then we also monitor for critical staffing of essential personnel. And that's becoming increasingly important as we're seeing a higher volume of patients coming into the hospitals and the clinics. And all of that information also has to get reported to various state agencies, you know, to the Washington Health System or WATRAC or the CDC, the public health offices. So constantly reporting information and trying to find ways that we can be efficient with the amount of time it takes to collect all that data has become important. We obviously reduced all of our access points into the hospital, and that's challenging when you want to be there and be present for your community, and with limited visitors. That's been hard on our patients, it's hard on our staff. Obviously it's hard on the patients' families. So constantly addressing issues like that. We also took opportunities to adopt work from home capabilities for many of our business office staff and our IT staff. Required an awful lot of IT support, resources, planning, and oversight, particularly when much of the work that we do in the healthcare system revolves around PHI. Using Zoom and WebEx have really helped us to be more efficient. I see that that's something that will probably continue into the future. And some other areas where we really outperformed, we set up respiratory clinics. We did pop-up acute respiratory clinics in our communities to help reduce the burden of our urgent cares and our ERs becoming heavily laden with patients coming in, thinking they had COVID, or maybe trying to keep those patients with respiratory issues segregated in a way where we could then care for other patients that needed emergency services for other reasons. Our employee health program continues to be challenged with a higher than normal need to coordinate with local public health departments, investigate potential staff exposures, and then monitor the health and safety of our essential staff and their ability to work in every different scenario. And just like with the other organizations, communication is really, has been critical. We had a great communication model for an effective response. We had a strong framework both for internal and external communications. And internal communications were shared, via email, weekly publications, intranet resources. We continue to have a COVID communication that goes out that's just everything and anything COVID. We have external communication that has been provided through press releases, patient and visitor information handouts, educational pieces, social media, and signage. We've also had to find ways to provide as much social distancing as possible in our facilities, which has required new ways to approach patient care, just like telemedicine. So we saw an increase in telehealth visits, and we continue to work on ways to reduce waiting in line for services, and by looking at things like beepers and mobile messaging. So overall, we continue to learn as time goes on, and we adapt as quickly as we can once we see that we have a need and we need to be responsive to what our community needs or what the CDC needs or the public health offices need. Our teams for the hospitals and clinics have been incredibly resourceful in this trying time. And while we can all really feel the winter fatigue setting in, our staff are our strongest and most resilient assets to battle the virus. And so protecting them is really one of our top priorities so that they can continue to care for our communities. And that's what I have. If Brian or Danny want to add to that, they certainly can.
Thank you, Yola. I particularly like what you said about protecting the staff. I think we've all had to jump to that first, and then worry about supply shortages or where we could support each other. And I just want to publicly thank the leaders of the organizations we work with. You've been fantastic to work with during this pandemic. We usually have, my experience with emergencies have been short-term emergencies like the Oso mudslide, where the response phase has a definite period of time, and then you move into recovery, which can be multiple years long. In this situation, all of our systems were challenged at the very beginning. Our health systems, our education systems, our social safety net systems, and our economic systems. And so the recovery phase is now starting, but it's going to be a parallel path and probably a long time coming. And as vaccines come online and we figure out how to safely distribute these into the community and having those right distribution points, we have a lot of work yet to do. So it's probably very timely we're talking about joining up in emergency response systems, sort of serendipitous. And so we'll now hear from our fourth partner, which is PhD3 and Artis. You want to give us an update?
Yes, thank you. For us, as all of our services were in person that we were providing to the district residents, we had to obviously close all those services down immediately, and also with our staff go to utilizing working online from home and flexible schedules, as my two staff actually were homeschooling at the same time. So to keep them safe as well, we utilize flexible schedules and, as I say, working from home. So what we learned once we figured out the pandemic wasn't going to be short term is we had to figure out how to recreate the services that we had been providing to our district residents, to think outside the box, to become more creative, to redevelop our services with our partners, and to learn the technology for utilizing online services with our partners as well. So one service that had to change very quickly was our mental health counseling program with the Arlington and Darington school district. As this had all been done at school, once the schools closed, the counselors had to collaborate with the school principals, the counselors, and the families to figure out how to provide counseling via telehealth. In Arlington, it was a much easier job than out in Darington, as not all students have internet out there, but everyone worked well together, and all of the students that had been receiving counseling continued on and throughout the rest of the school year, and that is how we are still currently providing the counseling via telehealth, other than there's a couple elementary schools here, Chris, as you said, where you have kindergarten first graders. We have the counselors going there this year, and that's working much better for the kids there. We also collaborated with sound dietitians and worked with them to develop videos, pre-recorded video presentations on the healthy cooking, so we could continue those and post those on our website at StillyValleyHealth.org. Our yoga instructor managed to put together some videos for us for the first few months of the pandemic to help people with that were used to doing her services. And we have collaborated with Rays of Hope and recorded their presentation of creating emotional success during times of stress, which is on our website for anyone to listen to. And we are continuing to work with all of the other partners. We had been in process of opening up support services for mental health and a few other agencies. And as these agencies are developing the capacity to offer their services online, we are working with them as well. We feel the loss of connection with our partners in person. It's been great to be able to do a lot through Zoom, but we know there are still some people that learn better in person. And for our support groups, especially for those, we had some excellent ones going for living well with diabetes and living well with chronic conditions. And it was just amazing to watch people develop connections with others in a support group. You can do some of that on Zoom, but not to the same extent. So hopefully down the road, we will be able to do that. The other thing that we learned is, as has been said, is just to have grace and patience, be flexible, adapt to whatever is happening with our partners that are redeveloping their services, and working with our residents as they call and ask us, how can we help them in the areas we were working on? So that's where we're going. And in the meantime, we also had to continue the construction on our new building here in Smoky Point. We have a beautiful building, just cannot open it to the public at this time. We are hopeful that sometime in 2021 that will happen. So we continue that process as well. So.
Thank you, Art. I think all of our organizations have learned that we're probably a little bit more resilient than we knew when we're forced into immediate change in order to protect the health and safety of not only our staff, but the community. And so at this time, we want to kind of continue the conversation in some breakout groups. We're going to automatically break you out into groups for about a 15-minute discussion, and then Brian will bring us all back in together to sort of report out. And the questions that we're going to consider in our breakout groups are, what concerns are we facing during the pandemic as we move forward? And how can we work together to mitigate some of the impacts? Where can we share our strengths with each other? So are you ready, Brian? Okay, so you should automatically be sent to your breakout room.
That it? All right, so we're down to this is our group. So perfect, welcome. I just want to let this group know that we stream these meetings on YouTube, and so the breakout sessions become a little bit challenging because we can't, of course, capture all of them on YouTube. But this group has been selected to be the YouTube group so that we can continue to stream it to the community who wants to see or listen to us. So as the mayor said, we have a couple of questions to discuss and about 15 minutes to discuss them. And when our time is up, Brian Terry, our IT director, is going to just reshuffle us all back into the main group. So what concerns are we facing during the pandemic moving forward is the first question in there. And then what can we do to mitigate that working together? So I'll open it up for discussion.
Okay, yeah, I'll start off, and then we'll just kind of go the way we have the Brady Bunch squares. We'll call on you. I think going forward, we have some of the exact same issues and challenges that we had at the very beginning of the pandemic, as we're seeing the surge, and we don't even know yet what's coming after the holidays. But we already know there's a surge happening. I think every day about the health system capacity in our community, and can it be stretched again? And will the rubber band come back? And can we keep enough staff and employees safe and continue to work, do the important work that needs to be done while we're all challenged with staff quarantines and exposures? Go ahead, Brian.
Okay, thank you. I appreciate that. You're right on in what we're facing. Right now, if the health system is going to be overloaded, it's not going to be because of resources in terms of available beds or ventilators or anything like that. It is our human capital. And things are happening such as the learning from a distance. It's a wonderful thing, I believe, for people to be able to go to school or still learn. But what's happening is people are making employment decisions because they have kids who can't get childcare or care after school or whatever. And so they're having to make short-term employment decisions to meet the needs of providing care for their kids. And I don't think that helps any of us. It certainly doesn't help them in terms of financially, and our ability to continue to staff our hospital is getting challenged. So I would hope there would be a way we could work together towards how we provide that support for employees around town in terms of childcare. It's just a resource that I think is very challenged right now.
Felt it here too.
Yeah, and it's a big concern going forward, because we're thinking of the same things. We're kind of taxing our staffing, and they do, just like you said, Brian. A lot of them are homeschooling. At the same time, they're trying to work, and we're concerned about when all that's gonna, we're gonna lose those resources, or if we had a major outbreak as we're coming into the worst time of the year, how do we keep the streets plowed so that people can get to the hospital. But we want to, if we're very limited, we actually, even though fire and police are most at risk out of our group of exposure, some of our more sensitive areas are like utilities, where we have a very small group of people that know how to operate those plants. And so an outbreak could be extremely bad in those areas when people's toilets don't flush.
So after rationing your flushes.
Yeah.
I also worry about the stress and just the fatigue on the staff operating at this level for this long period of time.
The COVID fatigue is real. It's palatable. It truly is impacting. None of us have gone through this kind of crisis for this long. It really is getting challenging, and people are starting to do, though, things that might not be the smartest in terms of social distancing or masking when they're away from work, and then they bring, something happens, they bring it back to work, and then we all get impacted by this. So it really is, it's quite a challenge.
I think there's stress throughout the whole community, not just in our staffs. And I think that we're all feeling that. And there's, we're a little bit powerless to take that stress level down. It has to be an individual job at the moment. So in our communication, it's, we have to keep trying to help. Erica, do you want to weigh in?
Yeah, I think just to kind of tag on to talking about stress, I'm really concerned about mental health at all levels in our community, particularly our students right now. Online learning is working, but I'm sure that there are kids that are just struggling. They're feeling isolated. I think we are all appreciating now that schools are much more of a social safety net for a lot of these kiddos that we didn't really realize before. So along with worrying about, the hospital and staff and all of those kind of things that we do in general, that's kind of that weighs heavy on my heart right now. It's just, the mental health. I was, listening to something about the suicide rates, and just it's unfortunately becoming an issue. So yeah, it's just all of this is just heavy. It's such heavy and important things to be thinking about.
To me, it's both ends of the generation spectrum in our community. I worry about the seniors too.
Yeah.
We're social creatures by nature. And so I worry about the isolation and the lack of access and the lack of just being around friends and family.
Yes, absolutely.
Steve, do you want to weigh in?
Sorry, had to unmute. In some ways, it's either ironic or unfortunate, or it just is what it is. That this group that we have right now is this little subgroup of ours. Mayor Barb, you're the only elected official here. The rest of us are staff that is charged with the duty of implementing whatever decisions get made by the elected officials above us. But I think about two things, and I certainly echo Erica's thoughts. As my children are no longer in the school district, but as an employer within the city, I know that some of my staff is wrestling with childcare issues and the mental health challenges of being cooped up, whether it's at my office or at home trying to work remotely. Those are very real challenges for all of us. And I think about the concern about how we can do this in a way, how we can rally the population, the citizens to avoid the COVID fatigue and to continue to be vigilant and looking out for other people. You know, the last thing as the city attorney, the last thing I want is for the governor to issue some mandate to the cities that we're supposed to be out enforcing some new regulation when the city's budget is already strained. I think there ought to be some ways that we can try to encourage the population to act for the greater good. And that's I think a real challenge for us all.
I really appreciate those comments, Steve. And I think it's probably what I would suggest, which was the second question we had to discuss, was how can we work together to mitigate some of these impacts? And I think maybe it is time for some joint communication efforts to take the entities and the elected officials of all entities and the boards, and really to try to communicate to the public in a way that can help bring some hope, relieve some stress, point to the resources that may be available, but just really to jointly communicate that we do have a little bit of control in our own personal actions about how far this goes. You know, it's, as Brian talked about, it's those decisions we make. And if we can help people be heard or take the stress level down a little bit, or let them know, you know, how things will turn around when vaccines are out there and we can all move about more freely and we're not getting mandates from Olympia or things that we don't even have a prayer of enforcing, that maybe we can work together to reach a broader audience or gain more of a listening ear on that.
Yeah, kind of a unified message.
A unified message.
From all the organizations.
We have 5 minutes left. Any other thoughts? Go ahead, Brian.
If I could, that message is critical, and we're about ready to start facing the next phase of this pandemic, and that's the vaccination process. And if there was a way we can work together to support vaccines, you know, right now there's a lot of talk out there, and I think nationally, 1/3 of the nurses in the nation are saying they're not going to take the vaccine because it happens so quickly. We're all going to be facing this in our communities in terms of people not wanting to do it, and what can we do to help, you know, build confidence and support, because that's one of the ways we're gonna end this pandemic. And so I think it's a great opportunity for us to work together.
Is particularly hearing from the health systems in our community about what that research looks like going into the vaccine. It did have to move fast because it's an unusual situation.
That's right.
But, you know, if we can kind of pull out some of that data and help people understand that this wasn't something somebody made up in their basement.
That's right.
You know, that there was still a protocol that had to be followed. And I think I read today DEM's plan about how the vaccine will be distributed, and that's going to bring some challenges for us as well too, in terms of the different phases and where people can go. And so I really do think that there'll be some necessary joint messaging to show the community we're on one page and to get all 20,000 people in our community, and even more if you look at the greater community, to understand how that's going to happen. And the first one that comes out is going to be a 2-dose system. So you get a dose and 2 or 3 weeks later, you have to have another dose. So I do see some challenges with that in our community, with the fatigue and the stress I think most of our citizens seem to be under, with everything's just upside down and changed this year.
Absolutely. Totally agree.
Erica, anybody else have any other ideas of how we could work together?
Barb, I see that Sherry Kelly with the Arlington Public Schools is on. I don't know if she can hear or if she's got some things that she'd like to share.
I don't see her on my screen. I think she's in another group.
Oh, she is. Okay.
Oh, she keeps joining back in.
So, no, I think there are definitely opportunities for all organizations to work together, because ultimately we all want our residents to succeed and be healthy and, you know, see this through. So
some of the
there is light at the end of the tunnel, but boy, it sure seems dark right now.
This one's a little more out there, but some of the other things that, you know, as we get ready to start the 2021 legislative session, we've certainly all felt where the deficiencies are in our infrastructure or systems based on what people needed. We talked about broadband or access to broadband. I know we at the city teamed up with the school district to put in some hotspots for kids who didn't have access at home. I do think there's some opportunity to talk about some joint legislative agendas, issues that might have impacted all of us that would make our community better, not only for the residents, but for those who have jobs of administering systems in our community. Okay, we have 1 more minute, I'm told. So any last thoughts, ideas?
Just a general comment. I really give this group a lot of credit for truly trying to work together, you know, to meet the needs of our community. It's refreshing, I will tell you. I've not seen this kind of effort. Certainly where I came from in California, it was non-existent. So I really, I think it's a great thing and valuable for our citizens that this happens. So I guess that's a weird way of saying thank you for keeping this going.
I'm right back at you, Brian. To me, it's been a blessing during this pandemic to be able to call up you or Chris or any of the other organizations and figure out how we can solve some immediate challenges, particularly in the beginning with the PPE. Okay. And we all had to work together to make sure we could protect our staff. Yeah. You know, and then when the kids started going back to school to learn differently, we're all in the childcare business now. Every neighborhood is in the childcare business. Every employer is in the childcare business. And so these are things structurally, I'm hoping we come out of this, we can leave our community in a better place than where it was, you know, unprepared for all of our systems to be tested at one time in unimaginable ways. I quite frankly never imagined a disaster where we shut down our schools and we closed all our offices and we sent everybody home and our businesses couldn't operate either.
Period of time. All right. Ready?
Okay, we're going to join that. We're going to bring everybody back in.
Thank you.
Are you going to be the report person?
Yeah.
Okay. Thank you, everybody.
I tried to take notes, but be quick.
It takes 50 seconds.
Yeah. How are we doing time?
7:23, so we got about
about 3 minutes.
Yeah, about maybe 2 minutes because we're running short on time.
Okay. Brian, will you let me know when everybody's back? Or okay. I hope you enjoyed your breakout sessions. We had a great, robust discussion in ours.
We did too. I've never been in a breakout group. It was interesting.
Looks like almost everybody's back in now. So what we're going to do now is we'll have somebody from each group kind of report out what they've learned or what the key points were. And I apologize, you have about 2 minutes each to do this. So I'll just call on each organization or how many groups were there? Will you just tell me the lead on each one?
Brian Lewis for the first one.
Okay, Brian Lewis, do you want to report out from your group first?
That'd be great. So in my group were Bruce Lisser, Don Maloney, Tim Kavanaugh, and Judy Fay. And the concerns that we were facing during the pandemic moving forward is educating people regarding the vaccination and dispelling false narratives about the pandemic. And there's a concern that there was much disinformation that is so set in people's minds that we need a communication plan regarding the importance of the vaccination and how the education community can help distribute information for that plan. And that one of the comparisons that was provided was New Zealand in creating a team effort across the community, feeling a sense of team, that vaccination is vital and it's our responsibility. How can we work together to communicate? The thought that was brought up was a common place to plan, that we're kind of behind the 8 ball already in terms of facilitating a vaccination process throughout the community, so that we need to establish a place where planning can occur, where the plan can be distributed so everybody knows what the plan is, and start assigning responsibilities for vaccination.
That's great. I just want to throw it, I don't know if you all know, but on the Snohomish County Health District's website, they have put up their 28-page vaccination distribution plan. And it's subject to change, but I would encourage you all to take a good look at that just for the first wave to see what it's looked like they're setting up. Gary, do you want to report out on your group next?
Sure. So the concerns that we're facing during the pandemic moving forward, one of the biggest concerns was certainly about small businesses and how they can survive. There's also concern about how can people afford the rent. There's been some relief, but what happens when the rent restrictions are lifted? Certainly there's stress among employees, lots of uncertainty. That doesn't help with any of that. Although people said, the city's done a good job keeping things together and going forward. And then how can we work together to mitigate some of these things? Certainly keeping the lines of communication open is huge. Make sure to shop locally. That was a big one that came up a couple of times. That's really important. And also it came back to the evictions and how can we identify those families who might need the help. How many families are out there, how many community members are there that need the help? And we talked about, how do we get maybe a list, or can we survey folks? The food bank has identified folks who are in some critical need, and so maybe going that way. But yeah, maybe a survey somehow to identify those families or community members that really need that assistance. And so again, it's just important that we're all working together to try to address some of those needs.
Thank you. Paul, do you want to go next?
Sure. Thank you, Mayor. Well, I think we had a very robust conversation also. I think we could have gone an extra 15 minutes really easy. Some of the same themes that you heard in the last two. We talked a lot about healthcare system overload. And when we talk about that, we weren't talking about hospital systems, but really the human resource piece of it in all of our organizations, and how taxing it is for them dealing with everything that we have to deal with. And so that was a big concern. How to rally the community to combat the COVID stress, which kind of in the same lines as our own staff, and then developing a unified message to help support the vaccination. That's really our answer to this pandemic coming to an end, is for people to get vaccinated, and if we could work together on a unified message that would support that in the community, and give people some more confidence, that would be certainly a great mission for these groups.
Thank you, Paul. Chris, do you want to take us through your group?
Sure. So concerns there, this was across the board, was community trust. Are the schools safe? Are the hospitals safe? And that's a concern that some people are struggling with, even believing that there is a virus, and then others are very fearful of the virus. But there's so many mixed messages out there that we want to make sure that we are providing the data and the information on a regular basis to show the numbers, to just, to make sure that they understand this is a reality, this is what's happening. And so in other words, educate people. The other concern was mental health. And we have stressed out students, we have stressed out parents, we have stressed out, business owners. And so just that is a concern, and that the mitigating maybe action in this is that together, let's check on one another. Let's find ways that we can check each other and help each other. And I don't know, maybe there's a unified effort on that we can do together, but that's important to do. People are lonely. We talked about people being isolated. And so we need to take care of each other in that way. That would be a good way to mitigate us, find a way to check on each other. Another concern is information keeps changing frequently, and it's hard to keep up with it. And new protocols are, put in place, but we just, as we've said, we need to remain nimble and flexible, but it is challenging. And just like the vaccine that we're talking about, it was shared in our group that is not an easy task, because it involves vaccines that all have a different kind of storage requirement and storage life. And so that makes it a struggle of how we're going to do that, and then the different tiers. So I guess the mitigating thing on that is that we're just going to have to lean on those experts, because I certainly wouldn't be able to have those answers, but we can lean on the experts and trust that they will use their best thinking to pull together a plan. And then another concern was connectivity. We continue to have struggles in getting students connected to learning. And we've tried we have things in place to help, but there's still students that are not connected. And so, and the mitigating factor on there, we just have to keep finding the resources and keep finding the way to give kids access to the learning. The final concern was just making sure, it's not a concern, I guess it's a mitigating action, would be communicating together, having common messages, and being supporting each other in those messages. And then the final mitigating factor is to continue being flexible. For example, the city and the hospital districts are all being flexible with their staffing, changing FTE. They can adjust FTE, and they've changed work hours so that parents can actually be home to support their students, at home. So continue doing that. That's all I have. Thank you.
Next up is Artis.
In our group, we had Jeff Miller, Sherry Kelly, Jessica Stickles, Madeline, and myself. And Jessica is going to start off with a feedback from our group, and then we'll chime in if she's missed anything.
So we focused on communicating timelines, and we talked a lot about the school district specifically. We would love to see some sort of, since timelines are so fluid, and we're looking more at mile markers right now, and there's a lot of good data from the CDC to say, this mile marker puts this amount of stress on the hospitals or this amount of stress on the businesses. So if the leadership at the school district could pick a solid number where you have a date that you take a snapshot on. So I know the January 19th date is coming up, but that's not actually going to be your snapshot date. That's the date that you're talking about possibly releasing kids back to school. So you do a 2-week prior snapshot date. If we've hit this number by that date, then we will open it up to the second and third graders. So parents are also watching the CDC site, looking for that specific number, just like you are. And it stops them coming back to the school district website looking for an update and what's new, when they know you're going to look for that snapshot date in order to determine that next quarter on what you are going to do. Possibly even having a what if information as well. So if we open back up and we hit this number, then kids will go back home. I mean, parents need to know that that is an option that could happen. And if we start getting close to that number, then they need to start making plans for childcare or plans for work, whatever. But that's the only way we really saw a timeline being able to work, is just by working on those mile markers instead of just saying, by this date, we're going to try to open it up, because it leaves it there's too many variables. And then as far as the communication goes, since we're all in collaboration already, if we did something like a community partner notice, like we call it that, we brand it that, then that means anytime the school district or the health departments have something to send out, the city sends it to their distribution list too. I mean, it's like all of us have our huge distribution list. So if we call it a community partner notice and list who our partners are, then it's known that this information could be from any of these partners, but all of our messaging is going to be the same. We're going to blast it through the city, so you're hearing the same thing from all of us. Thank you.
Thank you. Okay, and our final group is Yola.
Yeah, so similar topics across. So issues we face: procuring and storing of supplies, staffing, labor needs, communication, vaccine education and distribution, concerns about job loss, paying bills and rent, the effect of homelessness on our communities, and keeping our workers, keeping our kids safe. We also talked about the mental health issues, kind of the battling the COVID stress and fatigue that Paul talked about, all of the same types of things that you've all brought up now. Areas where we think maybe we could mitigate some of those or collaborate, that might be cohorting workers for like a community labor pool, where there isn't skilled labor, we can, create opportunities for some to fit into that role. We've got needs possibly coming down the road for vaccine distribution, procure and storing supplies. Maybe there's a centralized place to, house those types of things, or large purchasing opportunities that we could cohort on. Common communication message, just like everyone else has said about the education, about social distancing, about vaccine effectiveness, whatever it is that we can all communicate at the same time, the same message. So everyone in our respective communities is hearing that, and then with that, having a medium to share that information as well. So that's what we had.
Thanks, Yola. It seems like working together for common messaging and helping get a good, honest, true message out to our community, and try to mitigate some of where the concerns are in the community. If we have people who don't want to take the vaccine or don't want to follow social protocols right now, that will help get our community back to normal. Sounds like we're all on board for that type of effort, and this might be the right time in this pandemic. I want to surface one more thing that came out of our group, because I thought Brian Ivy was so articulate and bringing this out, and it was like looking at what we might have to mitigate next. And we talked a little bit about the childcare, about the stress that it's putting on our staff and people in the community. And when people get under that kind of stress, they're maybe not making the best decisions, or putting families into places where they're making riskier decisions because of everything that's on their plate and trying to figure out. But if we lost our childcare systems because they had to quarantine or due to a COVID exposure or something, we'll all of us in the community, all our businesses will immediately run into staffing issues that are greater than what we've gone through for the past 8 months. So it's probably another common point we need to sort of keep our eye on and track that through the community, where that's at. They may have anything else burning that you think was missed in the groups at all? I'm going to throw one last one out there as we look forward to the 2021 legislative session coming up. This is a great time for us to have some conversations in our partnerships about things we want to advocate for in our communities where our infrastructure, our systems need some expansion. We know there'll be some dollars put into broadband this year, next year, probably out of the state legislature and stuff. And we should, again, use that common communication and that common messaging to be able to point out and advocate as a group for the deficiencies in our community that could make us better. Thank you, everybody, for your great input. I hope you feel that was worth your time. This is our first joint meeting that's been open to all of Arlington because this has been streaming live on our YouTube channel. So does any organization have any general announcements they want to make? Again, I just want to say, I think this is one of the strengths of the Arlington community to have these organizations working together for the health and welfare of the entire community. So we thank you from the city, all of our partners in this. Thank you for engaging in this. Our next proposed meeting is going to be on April 12th, and it will be hosted by Public Health District Number 1. So Skagit Regional Health will be hosting it. Let's hope that that meeting can be in person again. Or if we continue them on Zoom, we'll continue these conversations. But I think what the takeaway from this meeting is that we need to connect our communication staffs together to begin to work on. So you may get some more polling coming out about where we should spend time on what key messages that we need to hit immediately in the community. With that, I'll take a motion to adjourn.
Madam Mayor, I move to adjourn.
Second.
All those in favor? Aye.
Aye.
Meeting adjourned. Have safe holidays coming up.